I've read the social media wisdom saying we need to encourage our low back pain patients or clients to rotate their spine even if they have low back pain, because limiting our range of motion can lead to unnecessary fears, joint restrictions, further stability problems, you name it. And we need to practice our full range of motion to have the overall health of the spine in the long run. And as you probably encountered it, there is a movement amongst researchers, physios and trainers who want to unchain their patients from the absolutely old school limiting beliefs saying you need to have a bed rest after the injury, after disc injury for example, you need to limit your training load, you need to limit your range of motion, and I couldn't resonate with this movement more. It's excellent. We do the same with my team and I teach the same in my school, but, and this is a very huge but, as every oversimplification, like the social media wisdom, can lead to very serious problems without special expertise in human kinesiology and biomechanics, since not all the spines are the same. We are not the same. Combined a given movement repertoire of a sport and the given anatomy, combined unfortunate combination can lead to very serious problems, for example, in the level of the lumbar discs. A young martial artist approached me with a recurrent hernia. She's been doing martial arts, especially Shotokan karate, for years, and the first hernia could be resolved with a very strenuous and demanding movement therapy. It wasn't an easy job, and she went back to practice completely pain-free, and in a matter of some months the pain came back in a much worse condition and a bigger hernia occurred on the same level. So focusing only the biomechanical factors, let's consider what could be the potential causal mechanism behind this phenomenon. Let's take a closer look at the kinesiology of the spine. In the thoracic level, the surfaces of the intervertebral joints stand in a frontal plane, meaning these little guys here, maybe you can see it like this, yes, these little guys here are aligned vertically, letting your thoracic vertebrae rotate quite freely. If you didn't have ribs here, on this level, you could move like a rubber lady here, you can rotate like a rubber lady. Can you see that, this motion? But you have, and the ribs and the ligaments are restricting the motion. To summarizing it up, they are aligned like this, and you can rotate freely, nothing blocks it. And another feature of the thoracic spine, this is a cross-section of the thoracic level, the axis of rotation is in the thoracic level is exactly in the middle of the intervertebral disc. This is the intervertebral disc. You can create hernia here. This is a spinous process. This is a transverse process. You could see some minutes before. And the position of the intervertebral joints determines the axis of rotation. So you can rotate in this circle, and the middle of the circle is exactly in the middle of the intervertebral disc. And meaning the crisscross aligned collagen fibers of the intervertebral disc can be this absolutely and the most. So no shear forces are created in this way, because you don't move the disc like this when you rotate, you just rotate it and the collagen fibers can resist it. This is ideal for bearing rotational torque. But now let's take a look at the lumbar spine, where the most degenerative spinal problems can be found. Opposed to the thoracic part, the lumbar joint surfaces, these guys here, lie in a slanted position. As you can see, there is only a minimal rotational capacity here. Can you see that? Because the bones are physically blocking the rotational movements here. Can you see this? But there is an exception to the rule in this lumbar area, the L5-S1 segment, and let's take a close-up, I show you why. The joint surfaces here, as you can see, lie a little bit more, I hope I show that, lie a little bit more vertically similar to the thoracic ones. The reason for that is twofold. First, we need a little bit of rotation for the energy-efficient walking, but this can be the topic of another video. And the position of the S1 with this inclination angle coming from the lordosis is creating a slide for the L5 vertebra, and sometimes a bony restriction is needed against this shear force, and the frontal alignment of the joint surfaces here can give this so-called bony stability. So it doesn't let your L5 slide towards your abdominal area. Another feature of the lumbar area is the following. This is a cross-section again. The axis of rotation because of the position of the intervertebral joints. This is the intervertebral disc here, this is the disc with the annulus and the nucleus, this is the spinous process, this is the transverse process, this is the joints, these are the joint surfaces. So because of the position of the intervertebral joint surfaces, so when you rotate, the axis of rotation is here. It determines the axis of rotation, the center of this circle. So the disc, when you rotate, have to suffer a substantial shear force as well, because the axis of rotation is not here, but here. And when you rotate, you move the upper vertebra out from the line. So shear forces are created. This segment therefore can be a little bit more sensitive to excessive rotation, which is luckily not the part of the natural human movement patterns such as walking, running and lifting, but under unfortunate condition sometimes can be the part of a traditional karate practice. But let's go back to the martial artist spine. You can develop hernia, disc herniation, in two major ways. You can compress your spine with a huge load. This is the vertebra, this is the intervertebral disc with the outer collagen layer and the jelly-like material, the nucleus. This is the end plate, the border between the vertebra and the intervertebral disc. So when you compress your spine with a huge load, the disc transfers the pressure to the end plate of the vertebra. And sometimes, if the load is too much, it collapses. There will be a small injury here. Sometimes a little hole is created here. Like this, the collagen fibers of the annulus, this outer layer of the intervertebral disc, lost its integrity. And the jelly-like material, because of the delamination of these collagen fibers in these layers, can leak between these layers and collagen fibers. And this procedure with the inflammation here, bringing immune agents here, which can lead to faster degeneration, can weaken the disc, and the pressure of the sitting way of life. The pressure with this position, this, sorry, because of the weak drawing, can finish the procedure in a matter of some decades or years. But according to Professor Grakovetsky, this is the more comfortable way of having disc herniation, because the spongy bone can heal and you can be recovered in a matter of half and 1 year. The other way, and this will be the interesting for us, is the excessive rotation, and this is the harder one. In human locomotion, a small amount of rotation is needed. This is what the discs are cut out for, but there are some exercises which they are not necessarily. Before we study the other mechanism, I can't emphasize enough that karate is a very healthy art with numerous beneficial factors, so it can be absolutely preventive for low back pain as well. But an unfortunate combination of the movement repertoire and the given body structure, as in every sport, can lead to overload and it can lead to injury in the long run. Let's see how. The main element of traditional karate practice is this rotating the pelvis. This drives the blocks, the punches, even the steps. And by doing this, the stance is deep, the frontal knee is stationary, feet on the ground, and all of this create a closed kinetic chain. So the $1 million question is, can these joints, all the joints participating in this movement, cover this range of motion without placing too much load on one separate segment of the spine? If they can, this is the key to healthy practice for 100 years. But if they can't, and placing too much load, too much rotation on one segment, on one separate segment which is not cut out for that, this will lead to problems. Having a genetically positioned hip socket on the outer side of the pelvic bone, especially if it's more shallow, will let the pelvis rotate in this motion on the full range of motion. Nothing stops the pelvis from doing this because there is a full free range of motion. Meanwhile, having a hip socket on the anterior surface of the pelvic bone, especially if it's deep, will stop the pelvis from going through this whole range of motion. Just take a look at it. I will stop here because my bones don't let me go further, and the other body part needs to continue the motion. In most of the cases, the mobile dorsal segments can handle it. So even if my pelvis can go through the whole range of motion because of my bony anatomy, the dorsal segments can continue the movement and my fist will get there. And technique is properly done. But sometimes, for the sake of the proper technique, the muscles around my shoulder blades need to be contracted like this, and this can stop or block my dorsal segments from their full rotational range of motion. Meaning, I won't have the complete pelvic rotation. It's just a question of interpretation, because I have the full range of motion of mine, but don't have the full range of motion for the technique, but it's a philosophical question. So I don't have this, I can't rotate here, and my fist still just here. I have to get it there. What is remained? We learned that the lumbar segments can't rotate too much, 1 degree on each level, but luckily we have an L5-S1 with a bigger rotational range of motion, so I will finish the motion from it. What did I do? I place a huge rotational torque on a separate segment which doesn't like it. Before we go further, the human intervertebral disc is extremely robust, so she needed to do that 1000 times in each training every day for more than 10 years for an injury to happen. So it doesn't happen overnight, and very intensive practice is needed. So sport is always good. This is the first rule. But this excessive rotational movement can pull down, pick the collagen fibers of the disc from the end plate, causing delamination, meaning the layers of the annulus fibrosus, the outer collagen layer, will lose its integrity, and the jelly-like material can leak into these layers. And in the long run, it can cause harm because it weakens the discs, and after that, a sitting way of life, with tilting the pelvis back and giving a pressure from the frontal part of the disc can lead to a hernia in the posterior part. So it's a very obvious way. And the chances are that this kind of hernia recur is much greater because the spongy bone of the vertebra can heal, so it can be rehabilitated. This was a previously mentioned compression mechanism. It can completely heal, but this case, when you rotate, the rehabilitation process is much more difficult, and with continuing the excessive rotation of the critical segment is more likely. At this point of the video, maybe a question arises, what can she do about it to avoid this L5-S1 rotational overload? The thing is very simple, and before we go into detail, I want to emphasize that rotation is absolutely needed for her, because rotation can strengthen the stability system, the proprioception, can strengthen the muscles, you name it. So she needs to rotate, it's inevitable, but she needs to avoid this overload on the L5-S1 level. We need to separate these two things very, very precisely. So what can she do? She can, for example, replace the traditional gyakutsuki of traditional karate to a more Western-like punch, where the heel can be raised from the floor, giving more rotational range of motion to the pelvis, because in this case the spine doesn't have to rotate excessively in this segment. And I know that she won't be kata champion like this, but her pain-free life is at risk, so it's her decision where to go now. How to tell whose disc will get injured? Actually, you can't tell for 100% sure. There are too many factors for that. The inherited anatomy of the pelvis and the hip socket is an important factor. The mobility of the thoracic spine is also an influencing factor. And there is a ligament here between the transverse process of the L5 and the iliac crest. Those who have longer process, anatomically, genetically inherited longer process, the ligament is shorter and limiting the rotation of the segment much more effectively. This is good for preventing the excessive rotation and, of course, the disc overload. But having a shorter transverse process here comes with a longer ligament and greater mobility, and as you can see, greater mobility is not always advantageous. Digesting social media wisdom can be fun and thought-provoking, so it's a very useful way. It can be a very useful way. But if I were to put together the training regimen of my trainings, I would rather use anatomy, biomechanics, human kinesiology books, thick books, because with them can we avoid the oversimplifications and generalizations of these social media wisdoms. It's sometimes not as entertaining, not as fun, it's only for the pros.